I think we have time for one more question from the audience, and this is on a subject that's very near and dear to a lot of SEIU members. Reggie Werner is an RN from UHS Desert Springs Hospital. Are you here?
Is it on? Okay. Hi, I'm Reggie Werner. I'm a new nurse at UHS Desert Springs Hospital. I see what happens to patients every day in the hospitals because of short staffing. And I also see what happens to nurses who leave the hospital because of job burnout and overall dissatisfaction. What do you plan on doing for safe staffing and nurse retention?
Well, we have a huge nursing crisis in America, which obviously you know about firsthand. I think a part of that crisis is dealt with by achieving a truly universal healthcare system where everyone gets reimbursed at a fair rate for the services they're providing. And in the context of achieving this universal healthcare system, we can regulate in a way that requires that the staffing be adequate. I mean, what we're seeing now, as you know, nurses working nurses who are the primary caregivers in a hospital, certainly in a hospital setting. They spend a lot more time with the patients than the physicians do. And in many cases, they're stressed, they're working long hours, and they're terrified, as you know, because I hear it every time I talk to a nurse. They're afraid that the result of all this is they're going to make a mistake. And the patient's going to be the one who suffers. So I think we need to, in addition to having a truly universal system, in addition to regulating in a way that keeps staffing at an adequate level, which is much easier to accomplish in the context of a universal healthcare system. I think in addition to that, we as a nation need to make a commitment to beef up our availability of nurses, which means more investment, more scholarship in nursing schools. It means providing an incentive to get nurses who are graduating to the places where they're needed the most, where the nursing shortage is most severe. In other words, incentive pay, some help from the government to help attract nurses to go to the places where they're needed the most, and then create a working environment that allows nurses to be the professionals that they so desperately want to be.
Well, that's our time, Senator Edwards.